Hey, you guys. Thank you so much for joining us. This is Matt and Andrew Vallo. We're back for Dental Unfiltered. Today we have a really awesome episode that I think needs to get addressed in the industry. And the title is SE double hockey sticks, sales. And this is a subject where the entirety of the dental world doesn't like the word. And what I will tell you is patients are coming to you in a heightened fear state. You have to transfer emotion to them that you're the proper caregiver and they like you. And that by definition is sales. So understand this. You are 100% in sales. There's no way to look at it. And it's a very important sale because somebody is choosing you for 4 to 8 years for their oral care. So Dr. Vallo, I know this was your idea to do this episode. Why don't you open it up and just kind of address the reason why you wanted to do this episode?
Guys, I think this might be one of the more impactful episodes out there. So I definitely recommend that you pay close attention to what we have to say here. I recommend you consider what we have to say and think about making changes in your own practice. When I first opened my first office, I really wasn't focused. I mean, let me backtrack. I was never that dentist that was like, ooh, sales is a dirty word. I know that's a common trend in dentistry. I just honestly didn't think that much about it. So I was the most focused on how many new patients can I get in the door? And I did very good at that. I did very well at that. I brought, from the very beginning, my very first startup, I was bringing 100 plus new patients in the door consistently every single month. And that scaled to 150 to 200 to 250. And so, now I've got all these practices that are mostly newer startups, and each practice, typically sees 100 plus new patients per month. So that's a skill set that I've mastered, and part of it is my willingness to invest in great marketing and working with a great marketing partner here with Energize. But something I didn't focus as much on was making the most of the opportunities of the people that did come in the door. So, I do feel like when I was a practicing dentist, I always had a knack for diagnosing everything that was there, for portraying urgency and scarcity. And so like when I was in the practice, especially when I was the main doc in my flagship office, our treatment acceptance percentage was always pretty solid. I mean, we were doing some pretty crazy numbers. I was without doing any surgery, no implants other than like basic extractions and stuff. I was consistently doing 200K plus a month on my own personal production, working 4 days a week. So, it was there, but I realized it had a lot more to do with the fact that I was lucky, or, I was doing a good job conveying the urgency and scarcity for treatment and portraying the value of the treatment and all that stuff. But I didn't really pay any attention. Like at first, we didn't even have treatment coordinators. So, there was really nobody responsible for actually selling the treatment. I just left it up to chance. And fortunately, we were closing, enough treatment to be very productive. As we started to become more associate driven, as I started to step back from the chairs, we opened more offices. That was when I first realized like, hey, we really need like somebody in charge of presenting treatment and like probably following up with treatment, because there was no treatment follow-up system at that point either. It was just whatever we were closing, or if patients were, calling to follow up. So that's when we started adding treatment coordinators. But at that point, training was pretty basic, and there was no tracking of KPIs or metrics. We didn't track each treatment coordinator's, close rate, acceptance rate, anything like that. As the group grew and as we added more offices and more associates, I got better about tracking our different KPIs. And I realized that at some of our offices, our treatment coordinators were closing 70 to 80% of their treatment on a regular basis. And at some offices, our treatment coordinators were closing 30 to 40% of their treatment on a consistent basis. And, big shocker, the offices where they were closing 78% of the treatment were just absolute rocket ships. And they were helping to carry the group. And the offices that were doing 30 to 40% of their treatment were doing okay. I mean, fortunately, you plug in enough new patients, even at a low treatment acceptance percentage, you can still do some pretty solid numbers, but we were missing out on so much potential. So, at that point, that's where it really got ingrained with, okay, like treatment coordinators are tracking their daily close rate. That's how we came up with our daily deposit sheets where treatment coordinators were on the left side writing the name of every patient they took a deposit from for new treatment, and on the right side, the name of every patient who did not put a deposit down to start a new treatment that they presented to. They were calculating the percentage of these patients that they closed treatment on, took deposits, scheduled a treatment. And then we went a step further. And so then we started sending out weekly standings of the treatment coordinators and what their close percentage was. So, and there'd be an email that went out to all the TCs and the OMs. And in the email was essentially, think about a baseball division standings or whatever it was. At the top was whoever had the highest percentage for the week, and at the bottom was whoever had the lowest percentage for the week. And so then we started wanting to add bonuses into it. And so we were then adding monthly bonuses where the top 2 treatment coordinators for the month on close percentage were getting a bonus. The top was getting an extra 250. Now, our TCs are already bonus. They get a small percentage of the total adjusted production that they close, or the total adjusted production for the office for the month. So they already have their own bonus system they're already getting, but we wanted to further encourage that friendly competition where it's like, hey, fight to be the best. If you're one of the 2 best for the month, you're going to get an additional bonus on top of your regular treatment coordinator bonus that you're getting on production. So this has been the evolution of our treatment coordinators, over the last couple of years in our group. I'm going to turn it back to Matt. I know he has a little more he wants to talk about sales, and then I'm going to talk about where we're headed with sales in my dental group moving forward.
So you create competition and a sense of like, I did X good of a job, and pride in the job you did, and I did better than you. Then the next month they do better than them. And I think that even in dentistry is like, oh, you can't do that. Like you'll hurt someone's feelings. Like, listen, guys, it's about results, not feelings, unfortunately. And if you want to grow your practice, you better get your mindset right where feelings, listen, you got to have a happy team, but you want to create an environment that is high pressure and is driven for goals. And unfortunately, part of that is competitiveness.
Yeah, I want to touch on that for a second, man. So there are 2 very difficult employee situations. I was going to say in dental, but I guess honestly in any business. Those 2 very difficult situations are the people that are a very high match for core values. They're just a great person. They have a great attitude. They're a great team member, but very low performers. And so unfortunately, you have that sometimes in sales or treatment coordinators, because at the end of the day, there is training that you can provide. There are systems that you can have in place. Some of it does come down to the job that the doctor and the hygienist, do with the initial treatment diagnosis and presentation. But sales is an innate skill, and I do think it's tied to personality. I think you've got to be that. You've got to be, so, if we're talking about DISC, the assessment test, you've got to be the I. You've got to be that person who is excited, charismatic, bubbly, talkative, not, confident, not afraid to hear no, like all that stuff. You've got to have that personality type to be truly great in sales. And if you don't have that I personality type, unfortunately, you're probably not going to do as well in a sales position. So you've got that person who is a great person, great culture fit, but they're doing poorly in sales. And you're not going to know it if you're not tracking these individual stats for treatment coordinators. So this is creating individualized accountability. My goal is for every position, every team member has clear understanding of what the expectations are and a clear way to measure what their results are. And so that's what we've created for our TCs. At the end of the day, our TCs know if they met, what the expectations were. The expectations across our organization is 65%. That is the goal. The goal is a minimum of 65% of the people that you present new treatment to make a deposit and schedule some type of treatment. That is the goal. So we are creating that individualized accountability there. Now, I had mentioned there's 2 types of difficult employees. The other type, and we've run into this with our treatment coordinators as well, and we, unfortunately had to let one go that was performing and had good results. But you've got the really high performers that are poor core value fits. And, maybe they're not, they're probably not a bad person, Maybe they're going through something in their personal life, whatever it is. But I mean, if they're coming in the office and they are not getting along with other team members, they're, gossiping, they're complaining, they're, just causing conflict left and right. I don't care if they're closing 85% of their treatment. I mean, we're going to try to work with them first, where, we're going to have those conversations about, hey, what does that action say about our core values? And, basically like having that come to Jesus meeting of like, you're performing really well. We'd really love you to continue to be a part of our team, but like, you've got to be a team player to be part of the team. So like, is this something we can move past? Is there something I can do to help you? Like, we're going to try to see if we can salvage that relationship. But at the end of the day, if they can't get their act in order, even if they're amazing with patients and closing, 85%, 90% of their treatment, you can't destroy the entire culture of the office because of that one great salesperson. So we've had to let, I think, 2 good treatment coordinators go because of that fit issue with the culture. So those are the very difficult employees. They are tough to deal with, but you've got to make those tough decisions. If you've got someone that's a great culture fit, but they perform very poorly, especially in a very important position like treatment coordinator, sales department, you need to either find a different position for them or let them be more successful at another opportunity. Because honestly, you're doing them no favors either by keeping them in a position that they're failing at. You've got to, as a business owner, you've got to get comfortable with those uncomfortable decisions, those uncomfortable conversations. If you've got a high performer that is blowing up the culture in your office, even if in your head you're building it up, if I let this person go, my office is going to fail. We're going to take a nosedive. Production is going to go down. And I understand those feelings and like they're warranted. But at the end of the day, you will find someone else and your team will respect you way more for it if you let that high performer go and you bring in somebody else that's a better culture fit. So
I had a client, really interesting story. So we were giving this client pretty good flow of new patients, right? And there was 2 docs. There was 2 docs in the practice. And let's say they got 50 patients a month and 25 went to doc 1 and 25 went to doc 2. Doc 2 would convert like 20 out of 25, really good case value, really good treatment. Doc number 1 wouldn't convert anybody. And we had a meeting, and doc number 1 is like, I don't want to pay for this anymore. These are all bad people. And they hadn't really looked at the data. And I said, well, doc number 2 is converting 20 out of 25 at an average patient value of 2,600. And he's like, no, he's not. And I showed the data. I was like, he's done it every month for the last 5 months. And he's like, that can't be. I'm like, it is. He's like, so you're trying to say I'm the problem? Yeah, doc, you were the problem. So listen, if I'm putting 50 patients in your chairs and you convert none and he converts 20 out of 25, it is mathematically impossible that he gets all the good patients. So I said, all right, doc, but I can help you through this. And this doc had like a really dry personality. But he was a really nice guy, though. Like, he was a nice guy. Like, I liked him. And I really wanted to help him with his struggles chairside. I said, doc, can I ask you a couple questions? He's like, sure. I was like, are you married? Do you have kids? I knew the answer to this. And he goes, no, I'm 45 single. I'm like, how do you feel about first dates? He goes, I hate them. I'm like, okay, every time a patient's in your chair, you're going on a first date with someone who's in fear of you, who our fee-for-service patients have probably avoided the dentist for a while. That is the conditions of that first date. And that's why it has to be sales. And he snapped. And he was like, I don't want to be a salesperson. That's why I'm a dentist. And I'm like, doc, this is a reality. And he always focused on like how clinically gifted he was, which I think is very important. You guys that are clinically gifted, I'm so happy you guys developed your skills. You've seeked knowledge. And you guys are amazing artists in someone's mouth. And I think that's great. But the problem is, you can be the most clinically gifted dentist in the world and have no patience if your chairside manner sucks. They are picking your chairside manner and your sales ability to find out if you're clinically gifted. And I think it's like, I think this negative connotation has kind of spread through the industry like a virus, and people have embraced it and be like, oh, that's the way it is. I think that if we kind of reframe it a little bit, docs will embrace it more. So, dental professionals that are in the office, their job is to do what's best for the patient all the time, right? But what's best for the patient is to get them to treatment. And let's call it just relationship building and not sales, just for a minute. It's important to build a relationship with that patient, and the tool to do it is sales. And sales is not finding treatment that's not there. Sales is not like manipulative tricks. Sales is building value and navigating the human terrain of the patient. Now, what I will tell docs is the number one killer of case acceptance and sales is you talking too much. That is number one, without a doubt. Number two is over treatment planning and not knowing your patient. But number one is talking too much. So the problem with talking too much in the sales process, this is why you need a consistent, structured sales process that happens intentionally, is when you talk too much, you are stealing time directly from the case presenter. And they need to have a lot of time. So my opinion for docs is this. I'd love your opinion, Andrew, is I think it's a 15-minute process for the doc, and it's a 3-part act. I think part 1 is navigate the human terrain, get to know the patient. That's the first 5 minutes. Second 5 minutes is in a simple, easy to understand way that is not technical, communicate their clinical needs and the solution. The key is not technical. Explain it in a way they can understand because they have the dental IQ. Third is setting up your case presenter and the handoff to them. After the 15 minutes, what I tell my docs is imagine you're losing $1,000 a minute, and it's 2 places you're losing it. And the first one should really make a lot of sense. Every minute you're in the operatory, your hands aren't moving in another operatory. So it becomes a bottleneck for production. Number 2 is every minute you kind of like steal is 1 minute less that your case presenter has to build value to get the most treatment accepted. And it's not the most treatment accepted in the spirit of we have to get all the money. It's the most treatment accepted to get ahead of the dental problem and not kick it down the road. And if we serve patients to the highest level, they will trust us and accept more production. And that's not like dirty sales. That's like investing in the patient, which is sales.
I don't know, man. 15 minutes for a doctor exam sounds like an eternity to me. I would rather have an effective 5 to 7 minutes than 15 minutes, honestly. I think the way that we train our teams is either the hygienist, the assistant, and one of our offices, actually the treatment coordinator, often starts and then finishes. But somebody else is in there going through everything possible with the patient first. They're building up the doctor. When the doctor comes in the room, they're basically doing the introduction. They are kind of reaffirming what was already discussed, and they're maybe giving a little bit of their take or spin on it, create a little bit of urgency and scarcity, and then, basically let the patient know, hey, Susie's going to take care of you, and she's amazing what she does. And I will see you, within the next week or so to get this done. Or I'm going to have Susie see if she can find time in my schedule to do this today. That would be whatever. They're giving some kind of timeline for when they want to see the patient back. But less is more, I think, when it comes to doctor time. And here's the thing too, at the end of the day, if I had to choose between the two, I would choose a doctor that is good with diagnosis, because you can't get treatment acceptance for what you don't diagnose. So they've got to have strong diagnosis. They've got to have a strong skill set, because again, you're not diagnosing and treating what you can't do. If they have those two things, and as long as they are they could be quieter, they can be, as long as they're respectful, they don't need to be amazing at creating that scarcity, that urgency, all that other stuff. If they just make the patient trust them and they diagnose what needs to be done and they're confident and competent in doing it, and you have an amazing treatment coordinator, you are going to get more treatment than if you give me a doctor that is just super personable, great at creating urgency and scarcity. Because here's the problem. If you have a mediocre treatment coordinator come in, they can blow the whole thing up. They call them the closer for a reason. So, you can get the patient can be excited. They can be convinced why they need to do it. But if the treatment coordinator comes in the room and they're not that I personality type, they're not super friendly, they're not helpful, they are not confident, they're not able to overcome barriers, the patient wasn't expecting it to cost that much, they're not encouraging to apply for different financing options and off. Literally, there are 100 different things that can go wrong and barriers that can come up during that treatment plan presentation, the financial part of it, that they've got to be equipped to handle every single one of them. So if you've got a mediocre to subpar treatment coordinator, you can have the most amazing doctor in the world and still struggle some with treatment acceptance. I would take the amazing treatment coordinator with again, the dentist needs to be able to diagnose. They need to be able to have the skill set. They need to be confident. They need to be respectful. But like, they don't have to have this amazing. I mean, it helps. It's great when you got the dynamic duo there. But if I had to choose just one of them, I would choose that salesperson. So this is what I'm saying, guys. Like, in dentistry, there's only so many people within the dental field that have dental experience that are great salespeople. And so, like, unfortunately, what we're stuck with is dentistry is a high learning curve, or a steep learning curve, especially if you're an insurance-based office. So it is versus a lot of other industries where they can bring in just somebody with sales experience and teach them, the ins and outs fairly quickly. It is going to take them longer to learn. But I do think if you can't find somebody that already has that dental experience, that is also has that personality for sales, I think you're better off going outside of dentistry and finding somebody that has sales experience, that has that personality type, that is like, hey, I could sell ice to an Eskimo. I can sell this pen, whatever it is, I can sell it. Find that person and invest in them and train them. It may take them a little time to get up to speed, but I think in the long run, you're going to end up with much better results. You can spend years trying to train somebody on sales skills. If they don't have that personality, if they don't have that, charisma, they might improve marginally, but they're never going to be that 80 to 90% close rate person. So
it's really interesting because, the part of it being consistent and intentional comes from somebody who wants to keep doing it and is excited about it and like wants to invest in it. And, I'll make a really simple statement of why sales is important. I think the key is like not just hiring a salesperson, but then hiring that salesperson and as a team with them, creating a very consistent, intentional sales process that both has, the patient process is consistent, but also the tracking and accountability of it is consistent, right? And, this is like the indicator I think sales is important. Dentists have two unique business conditions. At least I believe so. I would love to know your point of view. Number one, every single person on this planet needs you guys. That's a target-rich environment. There aren't many businesses that have the value of your services financially that every single person needs on some level, right? And I think it's an awesome business condition to have in the marketplace. Second is every single person fears you guys on some level. I don't care what anyone says. Everybody has some level of dental anxiety, whether they present it or not, right? Like, no one wakes up in the morning and says, man, I can't wait to hear a drill next to my ear. Zero people say that, right? And I think because those two conditions, when someone hits your chair, they've overcome the resistance barrier of fear, but they're still in some level of fear. And you have a lot of these opportunities. And to get the most out of that, you need a consistent, structured sales process with a good frontlines operator in the form of a salesperson to handle this. And when it comes to the fear part, like, you need that consistent salesperson because the person's already hitting your chair with negative feelings. And sales in dentistry is the transfer of emotion. And you have a limited window to get them over that fear, get them to trust you, and get them to pick you. And that is why you need a very consistent, very intentional sales process with a good frontline operator that is motivated by sales. And I think when you do that, you will take advantage of the target-rich environment and you will make the most in helping the people with dental anxiety overcome it and become patients of record.
Yeah, no, I think those are great points, Matt. And you had said something earlier that I think is important too. You had said you want someone that gets excited by sales. And I think that is so true, man. I think to some of our best performing, treatment coordinators, and they really do. I mean, like they get amped up, pumped up, to close big treatments. And I think it's twofold. One is, they're just like, they've got that competitive drive. And I mean, I think that's important. Like, to be good in sales, you've got to have that competitive drive along with the, that personality, that confidence, whatever. But I think also, like, they get excited because they know that we're going to be able to help this person. So, at the end of the day, that is the nice thing. While sales is important in every industry, and dental's not immune to that, even though a lot of people think that we are. Sales is important in every industry, and a lot of industries, they're selling crap. They're selling gimmicks, they're selling snake oil, they're selling things that are actually harmful, like alcohol and cigarettes, or whatever it is. We are one of those few industries where we're literally selling better health, better life, decrease risk of chronic conditions as we clean up infections and everything else. We're selling confidence, in the forms of new smiles. So like what we are selling is really good things, and we really are helping people. But in order to help people, they have to say yes. So if you can't bring that patient to say yes, you're not going to help that patient. So I think our treatment coordinators that do really, really well, they are like competitively driven. They want to be successful at what they do. And they're excited to help more patients. And they know the more yeses they get, the more people we're going to help. So I think that's really important. So I want to go back. I want to zoom out a little bit. So we're talking about the evolution of sales within my organization. And like I said, at first it was all up to chance. And we were just lucky. We were investing in good marketing. I think myself and the couple other dentists in the early stages were doing a good job, creating that urgency and scarcity and getting treatment closed. But we didn't even have a treatment coordinator. And if that's you, my actionable item to you, your action item, your next step to take, go find a treatment coordinator. Like seriously, if you own a dental practice and you don't have a designated treatment coordinator to present, close, and follow up with treatment, you are missing a major low-hanging fruit right now. So go find that person. So that was the very beginning. But then we brought in treatment coordinators, but we really didn't track anything. There was no individualized accountability or anything like that. We started adding that in. We started adding more incentives and bonus. I mean, think about it. A lot of industries, sales is commission based. So we're trying to go more towards that model where, they have the opportunity to earn significantly more compensation depending on their performance with the sales. So that was kind of that next phase of everything. And, we're sending out the weekly standings and monthly bonus opportunities and all that stuff. Well, now we're really ready to take things to the next level. And so that next level first comes down to recruitment. So we're trying to not leave it up to chance whether or not we find great salespeople for these positions. So we are instituting DISC testing. So we're going to do an episode about Colby testing, which is the general how you work type of test that we do. DISC is a little bit more personality based. And that's where I mentioned, like, you're typically looking for those eyes like that. Those are typically the good salespeople. Maybe an ID where they've got some of that dominance as well. They're confident. They're able to kind of command the room. But definitely looking for the eyes there. Also, like a sales assessment testing. So, I created my own sales assessment test for our organization, and it's 40 questions and it's timed. And there's a little bit of simple math in there about treatment planning. There's a little bit of insurance. So it is testing a little bit of dental knowledge, but it's also situationally based. And like, it's, multiple choice or true false. Like, what would you do in these situations? And it is just kind of testing their awareness when it comes to what the right response might be in different sales type of situations and overcoming barriers and things like that. So that is something brand new that we just rolled out. It's going to help us, really narrow down that field. We also on Indeed, we ask pre-screener questions to help weed people out. And, one of those questions like talks about selling, and it's like, how comfortable are you selling dentistry? And you'd be surprised. Like, and I asked that to doctors. I asked that to hygienists. I asked that to treatment coordinators now. So, you'd be surprised that people are like, oh, I don't like to think of it as sales. And that's like immediately, I'm sorry, that's the wrong answer. I understand that, you like to think of it as showing the patients the value or whatever else, but like the word sales can't make you uncomfortable or you're never going to be a good salesperson. So, I think having a more robust screening process can help make sure you find the right person. We're also going to be bringing on or promoting a director of sales. So essentially we're starting to get kind of like heads for, we're already in the process of promoting someone to chief hygiene officer. So we'll have kind of head of the hygiene department. We've got office managers. We now got a regional manager that just started. We've got operations officer. But I realized there's really no one directly, responsible for our quote unquote sales department. And we had never really considered it our sales department, but that's really what it is. Your treatment coordinators at your offices or at your office, that's your sales department. So especially if you've got a bigger office, you've got multiple treatment coordinators, you've got multi-locations, multiple treatment coordinators, I would suggest thinking about doing something like this where you essentially create your sales department. You have a director or head of sales. They're going to run weekly sales meetings. They're going to assign daily podcasts. So, I've started to research some of the great sales podcasts out there, and we're going to kind of have our director of sales vet some of these different podcasts and find good episodes they feel like could be applicable. And we're looking for 20 to 30-minute episodes that they can consume on their daily commute. But they're going to start assigning daily podcast episodes that then will be discussed in sales meetings and things like that. We're going to roll out some sales training. We'll probably do some online. I'm looking for some different modules and things like that. We'll probably bring in a speaker at some point. We might even bring, I'm toying with the idea of finding a sales trainer to come in and do a presentation at our annual summit that we're having this August. And that's not just going to be for our sales department. That's going to be for everyone in the organization, because I think everyone in your organization could benefit from some sales training. So we are trying to take things up another level. And I really, truly believe if you put an emphasis and a focus on creating a sophisticated sales department within your organization, it's going to move the needle more than almost anything else. We've already seen dramatic changes and improvements in, treatment acceptance, revenue, all that stuff since we started tracking these since we started having our TCs track their own daily acceptance rate and sending out these standings. And so we've already moved the needle a good bit, but I think this is going to even take things into new territory for us. And my goal by the end of this year is that all of our TCs are consistently doing at least that 65% minimum that we're looking for case acceptance, and that many of them are in that 75, 80 plus percent range. The last thing that we're doing, so here's the other thing, and I probably will have another episode where we even talk more about this, but I'm trying to create growth tracks within our organization. So I've realized, when you've got talented individuals, that they are looking for growth. And, sometimes it has to do with, it's tied to compensation. Sometimes it's just tied to, they want to feel like they're advancing in their career. And so we're going to create growth tracks for treatment coordinators, dental hygienists, office manager. So different positions like that. And basically I haven't even decided the terminology yet, level 1, level 2, junior, senior, whatever it is. I'll probably chat GPT it to figure out what are the best names for tiers of positions. But basically, we are going to create these growth tracks, and I'm going to set criteria that hey, if you maintain a treatment acceptance rate of, we'll probably set the bar, the base level will be that 65% that we're looking for. If you maintain this for a certain period of time, it might be 6 months, whatever it is, then you're going to automatically get promoted to a tier 2 treatment coordinator. And that's going to come with these benefits. And it might be an increase in base pay. It's probably going to be an increase in the percentage of adjusted production, basically their commission bonus. And so they'll have the opportunity to move through the tier. Okay, so you hit tier 2, your next goal is 75%. If you can maintain a 75% plus treatment acceptance for the next 6 months, you can move into tier 3. So we're going to work on creating these growth tracks for our sales department. We're going to work closely with our new sales director. They're going to hold these meetings. They're going to have one-on-one meetings with each of the different treatment coordinators to kind of go through their stats and talk about issues they might be facing and how they can get better with it. We're also going to create, so there's so many layers here, because I can't do anything too simple, but we're going to create quarterly treatment acceptance team goals. So basically the entire sales department, if we hit certain thresholds, everyone in the sales department will get a bonus, including, the director of sales and things like that. So trying to create friendly competition, but at the same time, trying to maintain that teamwork where everyone is fighting towards that same goal and everyone's working to make everyone better. I'll be excited to share with you guys the results. So again, this is something this is like a brand new step for us with this new level of sophistication that we're just kind of currently laying the framework for. We're recording this episode at the end of May. It'll probably be released sometime in June or July. I'll probably have some updates for you, later this year, November, December, whatever it is. And I'll let you know how it's all going. But again, my feedback to you right now is take a look at your sales department. Take a look at your treatment coordinators. Again, if you don't have a treatment coordinator, very easy today, put an Indeed ad up, go find one. I can promise you the increase in the amount of treatment closed and the amount of follow-up treatment closed is going to more than offset the additional payroll cost, even if you don't feel like you have the need for an additional employee right now. If you've already got someone in your organization that you feel like would be really good at that position, but they're in another position, you can consider, moving them into that role. But you need to have somebody whose sole responsibility it is to present, close treatment, and follow up with unscheduled treatment. If you're not doing that, you're missing the boat completely. From there, add layers of sophistication, add daily tracking, add individualized accountability, add, competition and rewards and things like that. And then if you're growing a group, if you're growing a really large single location or multi-location practices, consider, eventually laying the framework for a true sales department with someone who is in charge of it, a head of sales, director of sales. That's about all I had on the subject. But again, guys, I think this is really impactful stuff. You've got to get around the uncomfortability of sales and dentistry if you want to truly be successful. I'm going to turn it back over to Matt. I know he had something else you want to touch on here.
Yeah, I just want to say this really quick. So the first time I ever sold in dentistry, like sold treatment, I had no experience, obviously. And we had a practice that was struggling. It was in a state nearby that I could drive to. And the doc called me on a Monday, said, "This isn't working here. It doesn't work." I said, I just took a stab. I said, "I'll be there Wednesday." He's like, "Beware. It's like in your practice. I'll show up." It was like an 8-hour drive. I drove over there and I closed a $22,000 snap-in denture case, first case I ever presented. And I walked out of the room and they're like, "How'd you do that?" And I'm like, I just talked to the person, got to know them, found out what their needs were, showed them how we can address their needs, offered a few options that would help them access treatment better. And then they said yes. And the reality is, if you find a good salesperson, and honestly, other than my time in the military, I'm a lifetime sales guy. And I take a lot of pride in that. Like, people are like, "Oh, salesperson." I'm like, hardest job, supports every business. It gets you the one thing that solves all problems in business, which is revenue. Like, sales guy important, right? Like, really important. And I, as a older, very experienced sales guy now, I've been in sales since I was like 19, right? A good salesperson has this mentality. Show me a product, give me product knowledge, show me an audience. I will come back to you with money every time. It's very simple. Educate the salesperson who's a salesperson, show them the audience, and let them go to work. Once they get their groove and figure out that, you will see more. And the reality is, I'll tell you this also, our practices that have a good salesperson in place, I will tell you that their average patient value is significantly higher than the average practice nationally. Dental Intel says across their 11,000 practices, the average practice patient value is 606. ADA says it's 800. I don't think that's a real number. Our average patient value of existing in the practice when there's a salesperson in place is normally over 1,200. And that's almost double average patient value. So when docs are like, "I want to work less and be on the chair less," well, get a salesperson that runs up your average patient value for you, and you'll deal with less patients, and you will be in the operatory less, and you'll be making more money per visit. Like, the salesperson solves a lot of problems other than just revenue. If you want to do different procedures and you want to be in the chair less and you want to get an associate, the gateway for that is a salesperson. End of story.
Yeah. No, I think that's a great point, man. And I know we got to wrap this up here. I did just remember one last thing I want to mention. So we talked about vetting these treatment coordinators. The last piece of advice I have for you guys is, when you think you found a great one, bring them in for working interviews. And usually we'll have them do it 2 days at least. So we're like throwing them in the fire, man. Like, they're coming in the office. we're giving them a quick rundown of kind of how our systems presentation work, all that stuff. And then we're letting them loose and we're seeing how they can do. And I did have a doc send me one time like, aren't you worried about like if they're not very good and it's going to impact, the treatment, you're going to miss out on treatment. I'm like, dude, like I would rather have a crappy day or two of treatment, close rate than hire somebody and have 6 months before we decide to move on to the next person. So I think it is super, I know Dr. Goodman's not big on dental working interviews, and we don't really do those. I mean, honestly, when it comes to dentists, I can get a feel from their experience, their resumes, their conversation. My partner will vet some of their cases and stuff like that. So we don't really do working interviews for docs. Although sometimes we have temp docs fill in, and we have actually hired like temp docs before, who had filled in for other docs at our offices. But when it comes to TCs, 100%. That was probably one of the other most impactful things that we've done is starting to implement this required working interview for TCs. And if they come in for 2 days and they basically close no treatment and, let's say they present to 10 patients in 2 days and they close basically nothing, that gives you a really good insight into what they're probably going to do moving forward in your practice. But let's say they come in those 2 days and present to 10 patients and close 7 or 8 of them. And you're like, holy cow, this person doesn't even know our office or our systems. And they're already at 70-80% those first 2 days. That's also going to give you a good picture probably into how they're going to perform as they assimilate in the practice. So working interviews, a must for treatment coordinators at your practice. So
that's interesting. Working interviews for a treatment coordinator, but not for docs, where the industry thinks you do it for docs and no one's ever thought about doing it for a treatment coordinator.
But again, like I said earlier, man, I am more concerned with how good the treatment coordinator is when it comes to closing treatment than I am with the doc as far as that goes. So
that's more of a concern even than doc's abilities.
Well, no, I mean, again, the doc has to do sound work, but like that's you can get a pretty good idea just based on their resume, their experience, the conversations you have with them. And again, my partner is kind of our clinical director, so he will often vet. They'll send them some of their work and stuff like that. So I think without doing a working interview, you can get a pretty good feel for Doc's skill set and abilities and stuff.
We have to wrap this up. Hey guys, thank you for listening. Please hit like, subscribe, and share. Like we always say, me and Dr. Vallo do not have sponsors. We vet everyone that comes on the show. It's something we believe in, and we do this for the betterment of the community. It's an investment in all you guys and helping you get an abundance mindset and a growth mindset. So thank you so much for joining us. Have a great day, and please hit like, subscribe, and share.